gonna write it.
That's where it goes. So we can delete that osteolytic, but we need that. You didn't record that bit, Christian.
Osteolytic cancers.
Yeah, I have that. It's right here.
That part isn't for.
Oh, right.
This is for a different.
Hello and welcome to this video. Today we will be discussing cardiovascular imaging. Cardiovascular imaging scans our cardiovascular area using many different scanning techniques, the most common being the CT scan. Today we will talk about cardiovascular imaging. Cardiovascular imaging is a technology used in the medical field to help doctors diagnose patients, show defects and issues in the heart, and help us to discover more about our body. Cardiovascular imaging is the imaging of the cardiovascular area, which involves the heart, the blood vessels, and even the whole circulatory system. There are 4 different ways the cardiovascular area can be imaged. The main one that will be focused on in this video is the CT scan.
During a CT scan, the patient is placed on a motorized platform and all staff leave the room. The patient is then moved into the gantry via a staff-operated remote. As the patient travels through the gantry, the scanner rotates around the body using a small motor located inside of the machine. An X-ray tube moves around the patient and shoots X-rays through the patient's body. CT scanners use special digital X-ray detectors which are located on the opposite side of the source of the rays. The rays then leave the patient and are picked up by detectors and send the patient to a computer located somewhat near the machine. Cardiovascular imaging is used to indicate whether a patient requires blood thinning medication. These medications include Herapin, Apixaban, Dabigatran, Edoxaban, Fondaparinux, Rivaroxaban, and Warfarin, which slow down the body's process of making clots. Cardiovascular imaging can be used in diagnosis of heart disease, leaky heart valves, blood clots, irregular beating, obesity, and defects in the shape and size of the heart. It is also an important part in diagnosing aneurysms, osteoarthritis syndrome. Over the past half-century, we have managed to develop CT scans and cardiovascular imaging compared to the 1960s where physicians could only use a stethoscope and an electrocardiogram. We are now able to use harmless X-rays to find out if someone has cancer or not. Benefits of the CT scan include diagnosis to show parts of your body like the heart and blood vessels in more detail and the ability to look inside the body without the need of surgery. Although CT scans use ionizing radiation, after a CT scan is performed, there is never any radiation that stays in the body.
But there are drawbacks to CT scans. CT scans aren't recommended for pregnant women as they can damage the child developing in their womb. Another problem is that there is a small chance of developing cancer in the long term if the person has had many CT scans throughout their life. This happens because there is an excess amount of radiation on the skin. Some people are unable to afford this special treatment, which could save their lives. 50 years ago, cardiovascular imaging was introduced. Since then, a lot has changed. Soon we'll be able to overcome the current limitations we face today. Thank you for watching.
Visuals,
That's fine.
and then under that, Patrick.
Airdrop it to me!
Nigga, I will.
As long as you don't stop drawing it.
Yeah.
See, this is easier.
Joe, wait, can I write the next part? And then you can...
It was cancelled!
What?